Hi, and welcome back to Morgellons discussion and microscopy videos. I'm your host, Jeremy Murphy, and today I want to jump on here real quick and answer a question that I'd gotten on TikTok from my friend Diane. She wanted to know how I got to the point to where my Morgellons is manageable. It's in a manageable state. And what that means is where it's not bugging me all the time. It's not keeping me down. I'm able to go to work. I'm able to take classes and complete them. I'm able to go play sports with my friends. What was it exactly that got me to this point? Because a lot of people are trying a lot of things out there, and not a lot's really working. Hey, first of all, if you haven't already subscribed, go ahead and click that button down below. That would really help me out. Every time somebody shares one of these videos out with your friends, it gets the word out there that Morgellons is a real skin condition, and it's associated with Lyme disease. So that was basically the first thing that I did that really helped me get my head around what Morgellons is and how to manage it, was understanding Lyme disease. And Lyme disease is not a topic that a lot of places you can even talk about without people trying to suppress that conversation. A lot of people around the country think that Lyme disease and then concerns about it is a mental illness, and it's not. What it is people do not understand the reality of Lyme disease, and they don't care to understand it. And that's fine. That's the prerogative. But if you're going to deal with it, you need to know what's going on with it. And one of the first things I learned was that you can have a false Lyme disease test. You can have a negative Lyme disease test, or what's called a false negative, and still have the infection. There are several reasons behind this. One of the reasons is because the body doesn't always produce antibodies, which these tests are looking for. So if your body's not making the antibodies in response to the infection that is there, then that test won't show that the infection is there. Another reason is because you may have a different strain of Borrelia than Lyme disease. In my case, for example, I have tick-borne relapsing fever. It's also a Borrelia bacteria like Lyme disease, but it's a completely different test. That doesn't mean that because I do have TBRF, I don't have Lyme disease. It just means that the tests that I have to look for Lyme disease haven't been able to find it. And there are other infections that are like that as well, you'll find out. But if I didn't make time to learn about Lyme disease and why Lyme disease tests can fail and why you need to see a Lyme disease specialist, then I would still be lost in these online groups. Biofilm is a term that gets mangled in these online groups where groups of people come up with their own definition for what it means, and typically it's not what it really means. I took a course at the Costerton Biofilm Center, University of Copenhagen in Denmark, through Coursera, the online course repository, and I completed that course. It was tough, and I learned a lot about microbiology. But what it told me was that these bacteria, Lyme disease as well, can colonize inside the body. They can start to replicate and then cooperate and coordinate and even communicate with other bacteria inside the body to establish habitats to keep them safe from the immune response and from antibiotic intervention. If I didn't know any of that, I would be confused about what's going on, and I wouldn't be able to set the right expectation for what it's going to take for me to get better. So understanding what the problem is, why Lyme disease tests might fail, and to be clear, the CDC is saying that Lyme disease is a clinical diagnosis, which means your doctor has a set of criteria that they should be able to go through to determine how likely it is you've had exposure. If a patient walks in with Morgellons disease, that should be a good clue that they've been exposed to Lyme disease. And that's starting to become more and more accepted as the science has demonstrated clearly that Morgellons is a condition that results from Lyme disease. We don't know why it results, but evidence is starting to suggest that there's a genetic predisposition there. And that's why we got to come up with more funds. We've got to raise awareness so that people know that, hey, Morgellons is real. It's not what people were saying in these online groups. It's not associated with fungus. It's not associated with anything in the environment, but it is associated with a bacterial infection. When I say in the environment, I'm talking about airborne. You're still going to have people out there who don't want to talk about Lyme disease. They don't want to hear about it. They don't want to think that there's a possibility that they themselves could be affected. But with the CDC saying that it's likely over 500,000 Americans every single year are contracting Lyme disease, then you cannot be the only one, okay? But you can be one of the few people who pays attention to the facts, who pays attention to what science has said about Lyme disease. And the more you pay attention to that science, the better you're going to be able to wrap your head around why all this is occurring. But get a specialist. Get somebody who specializes in Lyme disease so you can transfer the responsibility and the burden and the stress of trying to manage your own health onto somebody who's qualified and certified to do that. That should give you peace of mind when you get a Lyme disease specialist to know that you're seeing somebody who is not only aware of what your condition is and what's associated with it, but stays on top of the latest science so that they know the most practical ways and efficient to treat it. And you're just not going to get that with people who have no reason to look for the Lyme disease research themselves. And what I mean is that the states aren't saying, hey, you have to take this continuing education that tells you about Lyme disease. That initiative just isn't there. That incentive isn't there for doctors. Because for the most part, most people don't even understand the severity of the situation. They don't understand that 500,000 people every year are going to contract Lyme disease in this country. They're not aware that if you're genetically predisposed, Lyme disease will trigger autoimmune conditions like fibro. And, because they're not aware and because they're focused on that stuff, because they don't want to associate bipolar depression with Lyme disease as it has been associated in the science, you got to get away from that, okay? Because if you can't talk openly about it, and if people start expecting that you suppress conversation about Lyme disease, that's not going to help you. You've got to talk about it. You do not talk about it all the time. But that's something that people who don't want to talk about it are going to throw up in your face, okay? That's gaslighting. You don't talk about Lyme disease all the time, but when you do talk about it, and when it's time to talk about it, people should be open to having that discussion. And unfortunately, it's just the case that they're not, because a lot of people in this country particularly regard conversation about Lyme disease as a sign of mental illness. They'll throw that right up in your face and say you're obsessed with Lyme disease. That's all you ever think about and talk about. But that's not true. You've got a job. You go play disc golf. You have friends. So, and especially when you're in regards to your family, because Lyme disease is congenitally transmissible, and there is evidence that it's sexually transmissible, you should be able to have this conversation without fear. If your family's having a lot of health problems, a lot of autoimmune and psychiatric mental health behavior problems, then they really shouldn't be excluding the potential for Lyme disease. That's just hurting them. But I know it hurts you to see them in so much pain and to realize that they don't want to even look at the potential to do something that can maybe help it. It's heartbreaking, but that's where we're at. So you have to learn to deal with that, and potentially on your own. But if you have a Lyme disease specialist, it's not on your own. You're going to be working with somebody who understands Lyme disease. They don't have any problems about talking about it. I mean, hell, they study it. There's a lot of people out there that have a lot of education, a lot better education than I've got. But they haven't spent nearly a fraction of the time reviewing the current science about Lyme disease comparatively. And I do that because it's responsible. I'm not going to tell somebody that, no, there's no way in hell they have Lyme disease because of 30-year-old science that's been disproven. I'm going to say, yeah, you may want to consider it and may think about seeing a specialist so that you can get that ruled out. Maybe you don't have Lyme disease, but maybe you have another strain of Borrelia. What do you guys think? Let me know. Leave a comment down below. To sum everything up again, what we're talking about today is what is the best way to get your head around, wrap your mind around Morgellons, and to be able to make it manageable so that you can go on with your life, have a job, play sports, do things with your friends. And really what it comes down to is understanding Lyme disease and understanding biofilm. And not what they're saying about those things in the groups, but what science says about those topics. If you can wrap your mind around that and get yourself a Lyme disease specialist, that's what I had to do to be able to get my Morgellons to where it was in a state that I could manage. All right. Hope you guys have a great week, and we'll talk to you soon.